I'm Dr. Shawn Panzer, and I want to welcome you to a video describing the practice of North Texas Gastrointestinal Associates, PA, located in Denton, Texas. First of all, I want to tell you a little bit about what a gastroenterologist is. A gastroenterologist is a doctor who has specialized in the study of the digestive system, and gastroenterology is a subspecialty of internal medicine. We're not surgeons, but we use surgical type procedures and techniques to both diagnose and treat the diseases that we deal with. We deal with diseases of the esophagus like reflux, stomach issues like a slow stomach and also ulcer disease, liver issues like hepatitis C, gallbladder problems, pancreas problems like pancreatic cancer, what's called chronic pancreatitis, also small bowel diseases such as celiac sprue, colon problems obviously such as colon cancer, irritation of the colon, and a variety of other things. It's a fascinating specialty because it deals with so many different things, from inflammatory disorders to infectious diseases, and unfortunately also cancers of the various organs. As you know, most of the common cancers occur in the gastrointestinal tract or are involved in some way. I grew up in Virginia. I was the son of a family that was in the military, so we moved a lot, but most of my schooling was up in Virginia and around that area. I went to high school in Virginia and graduated third in my class. I then went on to Wake Forest University, where I was a summa cum laude graduate, as well as Phi Beta Kappa in my junior year. From there, I went back to medical school in Virginia and graduated as a member of Alpha Omega Alpha Honor Society. I then came to Texas in my mid-20s with my wife of 30 years, and we did my residency at the Baylor College of Medicine in Houston. There I was asked to be chief resident. I also did what's called a clinical investigator pathway, which is a program which allows a person to do their clinical training and then move into research. And so I did 2 years of research in molecular genetics, and thankfully I was able to publish in peer review journals, and also received awards for that, and also presented at national meetings. From there, I went to Johns Hopkins, where I did my gastroenterology training. And when I finished there, I elected to do another year down at Baylor College of Medicine to consolidate my training before moving on into practice. I went into practice in 1996, and I've been in private practice since that time. And the practice of gastroenterology in Denton opened almost 9 years ago, and I'm a solo practitioner and an independent physician. I'm a member of the Physicians Association of North Texas, as well as National Federation of Independent Businesses. The practice is located at 2501 Scripture Lane, Suite 201. We're on the corner of Scripture and Bonnie Bray on the Texas Health Presbyterian campus. Our hours of operation are from 8 a.m. to 5 p.m. However, I cover my practice 24/7 unless I'm out of the country, in which case I have another doctor that covers the practice. When you, if you want to contact us, the phone number is 940-566-4720, and the fax number is 940-566-4727. We do have a website, www.ntgia.com. The practice is what I hope is a unique one, in that we try to follow three main principles. And the three things that I really try to accomplish in my practice is to be compassionate, to be competent, and to be contemporary. To be compassionate means that we want you to feel that you're the most important person we're seeing, and that you have adequate time to ask all the questions you wish to ask, and that you have a good explanation of what's going on. And I think that makes people feel better about what's going on, and that gives them a better sense of control. And so I want to make sure that from myself to my staff and to our billing operations, that you feel that we care about what's going on in all aspects of your care, not only the medical but also the financial, and that's a really important goal of mine. The second is to be competent, and I seek to know as much as I can about about gastroenterology and related conditions, and even general internal medicine as it relates to my specialty, because there's a lot of overlap between illnesses that occur in the intestinal tract as well as those that occur elsewhere in the body and are more systemic, like diabetes and hypertension and heart disease. And so I try to keep up with the latest developments, but also try to temper that with my own experience. Not everything that's new and hot is necessarily your best option, and so I try to filter some of that. With the internet, a lot of people come in well-read and knowledgeable about what's out there, but you don't really get any kind of filters, and I think your doctor has to provide that, and quite honestly, it takes time to do that. So my goal is to not have you come in here for 5 minutes with me answering 3 phone calls after waiting to see me for 6 to 8 weeks. My goal is for you to come in here and then leave knowing that we've put together a good game plan that's consistent with current literature, but also is also cost effective and appropriate. And then the final thing is we want to be contemporary. We want to make sure that we again keep up with current trends, but make sure that at the same time we temper that with what we know from the past and also what experience brings me. So compassion, being compassionate, being contemporary, being competent. I think those are three main goals that any practice should seek to achieve. I practice, of course, in my office primarily. That's where all the outpatient evaluations occur. We do have a program that's called a direct access program, which allows you to directly schedule procedures you may need. And I like that because I feel that exams like screening colonoscopies can be arranged and facilitated at the time of the procedure. And you don't need to take time off from work to come in here and for me to tell you, yes, you need to have a screening colonoscopy. Things like that we try to directly schedule and handle over the phone, which saves you money and time off from work, but also allows you to do it in a time-efficient and streamlined way. We do our own billing here at North Texas Gastrointestinal Associates, so I think that allows you to have a more, a more consistent process. We also do the best we can to help when problems arise with other vendors that we have to use as part of my practice. So that's a summary of what we're here to do, and I sure appreciate your time. And please visit our website down the road. We're going to be doing more videos which are going to be educationally based and to help you maybe develop a little better framework around symptoms as you're waiting to see me or another gastroenterologist. And I just hope that you have a great day and wish you the best in gastrointestinal health. Thank you for your time.